Good afternoon, everyone. So, does anyone have any questions from the last session? I'm going to share the screen. So, in the last session, we have covered till just a second. So, we were at we have covered basic introduction of the manual. What was the format and structure? What we have to report? What is the logic behind the placeholder character? And what is the role of the seventh character? These all things we have already covered in our last session. Next, we have the abbreviation. In our manual, we have two type of abbreviations, NEC and NOS. So NEC stands for book fault, whereas NOS stands for provider fault. So whenever a condition is described by the provider, however not listed in the book or in the manual, then we have to use a code with the NEC classification. We are able to find the NEC classification in the alphabetic index only. So we will get the NEC word in the alphabetic index only. And we have to use NEC code only whenever the code or the condition is described by the doctor but not listed in the manual. Let's take an example. Let's say patient have the bronchiolitis due to rhinovirus. Due to rhinovirus. So what we have to look? We have to look for the bronchiolitis in the index first. So bronchiolitis, it's bronchitis. Here we go. Bronchiolitis. And in the bronchiolitis, we have to look for due to. But under the due to section, we does not have the option for the rhinovirus. So what we will do? We will pick a code for the specified organism NEC. So whenever a condition is listed, let's say in our documentation, our doctor mentioned that it is due to the rhinovirus. But in our classification, code for rhinovirus is not listed. So what we will do? We will use a code for the NEC, that is not elsewhere classifiable. Not elsewhere classifiable. Not elsewhere classifiable. And when we look this code in the tabular, it will leads other specified. Here it is. So if we pull the J21.8 code in the tabular, it will leads other specified organism. So whenever a code listed as NEC in the index, then it in the tabular it will be other specified. So it will lead to the other specified. So whenever a condition is listed in the medical records, however, documentation does not classify or the book does not classify that condition, then in the index we have to pick a code for NEC classification which will route to the other specified code in the tabular. Next topic we have NOS. So let's take a brief look at the NEC. So even in the manual it was mentioned, this abbreviation in the alphabetic index represent other specified. So NEC represent other specified. And when we have to use this, when a specific code is not available for a condition, then we have to use NEC. Then we have NOS. NOS is unspecified. So when the condition is not documented by the provider or not specified by the doctor, then we have to use a code for the NOS series. So NOS is listed in the tabular only. NOS is listed in the tabular, whereas NEC is listed in the alphabetic index. NOS code will route to the unspecified code, whereas NEC will route to the other codes. So here we have the explanation of other and unspecified. So again, other we need to use when we are using NEC entry in the alphabetic index, and we have to use NOS when it does not have a specific documentation or information in the medical records. Let's move further. Next, we have punctuation section. We have three type of punctuations in a manual: brackets, parentheses, and columns. Brackets are listed in the alphabetic index, which will represent that this includes manifestation codes. So let's say we have a particular condition. Etiology followed by the manifestation. So based on the ICD guidelines, we have to keep our etiology at the primary position or as in primary diagnosis, whereas manifestation will always be the secondary diagnosis. Manifestation will be the secondary diagnosis always, and etiologies will be your primary diagnosis. So whenever we are unable to define what is the etiology and what is the manifestation, so to help us, we have the codes enclosed in the brackets to represent that these are the manifestation. So whenever you see a code enclosed in the bracket, it will show that this is the manifestation and it will be the secondary diagnosis only. Let's take an example. Let's say patient is coming with the dementia due to Parkinson disease. So what we will do? We will look for the dementia in the index. Here we have the dementia. So under the dementia, we have to look for the due to. And under the due to, we have to look for the Parkinson disease. So if we reach to the Parkinson disease, we can see we have two codes here, G20A1 and then F02.80 in the brackets. So whenever we have a code in the bracket, it will tell us that this is the manifestation code and it will be the
क्या मैं जेब में पड़ा ले ले ले
at the secondary position only. So with the help of index, we have the brackets which will tell us the sequencing guidelines.
कनेक्ट हो गया
We have two types of instructions. You can see it at K05. We have to use additional instructions which will tell us that we have to use additional code to represent whether the patient is using any alcohol or anything. So use additional will tell us that we have to use any code listed from the series at the secondary position. Secondary position. Whereas K05 will be a primary and any code listed here will be a secondary diagram. We do have the other type of instructions also, which will tell us that we have to code first. Same use additional, that we have to use these codes as a secondary, K11 will be a primary. Use additional means you have to use one more code after your code. Let's move forward. Here we go. You can see here, we have a highlighted instruction here, that is code first. So code first will tell us that we have to use one code before our code, and use additional will tell us we need to use an additional code after our code to represent the to further classify the condition. So in the tabular we have two types of instructions, use additional and code first which will help us to determine the sequencing of the codes. That what will be a primary diagnosis and what will be a secondary diagnosis. In the alphabetic index, we just have the brackets which will tell us that this should be a secondary diagnosis. However, in the tabular, we have two types of instruction which will help us to determine the sequencing of the code. Whenever we see use additional instructions, that means we have to use this code after our code, and code first means before our code. Any questions so far? Okay, moving further. Next instructions we have, so I'm just going to read it. The bracket will tell us if it is in the tabular list, it will include synonym and alternative words. However, if it is in the alphabetic index, it will tell us that this is a manifestation code and it should be the secondary diagnosis only. So manifestation will be a secondary diagnosis only, and to help us to determine the sequencing, we have the code first and use additional instructions in our manual. So etiology is our primary diagnosis always, and manifestation is a secondary. So there are two conditions where we have to code the etiology as well as the manifestation. In those conditions, we have the use edit code first and use additional instructions in the tableau. They are able to see the code first instruction in the manifestation codes. There are use additional instruction at the etiology code, which will tell us the correct sequencing instruction of the codes. Mashita, what part you want me to repeat? Okay. In the brackets, we have the manifestations. If brackets are listed in the alphabetic index, that will represent that this is the manifestation. And based on the ICD guidelines, we have to keep manifestation at the secondary position only. So to help us to keep the manifestation in the brackets to make sure that we will code those conditions at the secondary positions only. Here, Ashita, any doubt? Perfect. So let's move further. Next, we have parenthesis. Parenthesis includes the non-essential modifiers. Non-essential modifiers mean that code will not change if we have these type of classification or if we not. Let's understand this with the help of the example. Few questions. Okay. Just tell me the code of fibro fibroadenomas. So tell me what will be the code for fibroadenoma. You send the message that this will be the code. So the code for the fibroadenosis will be N60.2. Here we have the fibroadenosis and our code should be N60.2. So let's say we have a little different. Let's say our document says patients have the chronic fibroadenosis. Even though our question says if patient has the chronic fibroadenosis, our code will be the same. Why? Because we have the chronic listed here in the parenthesis. So the word listed in the parenthesis are the non-essential modifiers. That means if we have these words in our question, then we will consider these. But if it does not have these words in our question, then we will neglect. So let's say when the question does not have this chronic statement, then also it is our code should be N60.2. And when we have the code chronic listed, then also our code should be N60. So this word does not change our these words or these terms are known as the non-essential modifiers. So parentheses includes the non-essential modifiers. Let's take a look. Parentheses are in the alphabetic index and the tabular list both. It includes the supplementary words that may be present or absent in the statement of disease or the procedure without affecting the code number to which it is assigned. So the terms which is listed in the parentheses are referred as a non-essential modifier because if it is there, then also code will not affect. If it is not there, then also code will not affect and code will not change. Then we have columns. We have the columns in the tabular list only. Columns with under columns are.
Hello, ma'am, your voice is breaking. It's not clear actually.
Is it clear now?
No, ma'am, it's not very clear.
Just a second, let me see. Is it clear now?
Yeah, ma'am. Yeah, better now.
Okay. So the columns are listed after the category, the 3-character incomplete code. We have the column listed after the 3-character incomplete codes only. You can see here we have the 2 dots, that is columns. So column is nothing, that will just explain the condition. So you can see here after the A03, we have the shigellosis, and here we have the definition of Shigella. That's what is a Shigella or shigellosis condition is. So the columns are always listed in the tabular after the category. Category means that this code is incomplete and we need one more character to make this assignable or to make this as a complete code. Next we have other and unspecified. We have already gone through with the other and unspecified codes. Next we have include nodes and the inclusion terms. Include nodes and the inclusion terms are listed in the include term and the inclusion terms are listed in the tabular only. So I'm going to pull any random page here. So include terms are always listed after the category. These are known as include nodes. So include nodes are always listed after the category. 3-character incomplete code is known as category. So include node will help us to get an idea or to get an example of the category, that what all conditions are inclusive are included in the category K09 category. Inclusion terms are listed below the complete code. So the major difference between the include nodes and the inclusion term is include nodes are below the incomplete code or below the category, whereas inclusion terms are always listed below the complete code. So you can see here we have the K09, and these all are the inclusion terms. These non-bold terms are known as inclusion terms. So include nodes are listed below the category, whereas inclusion terms are listed below the complete code. This is in complete code. Inclusion terms will tell us that for these conditions also we have to use this code only. Whereas include node just provide the example that what type of conditions we can see in this category. So inclusion term listed below the complete code, which will tell that we can use this code for these listed conditions in conjunction with this also. Whereas include node just give us the example that for which condition this category belongs to. So you can see here it was mentioned here that this note appears immediately under the 3-character code, which is category because it is incomplete. The character incomplete node is known as category, and it will just define or give the example of the content mentioned in the category. Whereas inclusion term is always listed under the complete code, and these terms, inclusion terms, are the terms which will tell us that we have to use the same code for the mentioned conditions. Next we have exclude node.
Hello.
Yes. Okay. Next we have exclude nodes. We have 2 types of exclude. That exclude nodes are also listed in the tabular. You can see here. Here we have exclude 1.
Ma'am, I can't hear you.
Okay, everyone is not able to, or is it everyone else is able to hear me?
It's not.
Okay, let me reconnect one more time. It may be some issue from my end. Is it audible now? Or still you are not able to hear me?
Yes, ma'am. Now it's okay. Yeah.
Perfect. So we have two types of exclude in our manual, exclude 1 and exclude 2. Exclude 1 will represent that we have to use only one code, use only one code, whereas exclude 2 will tell us that we have to code both conditions. We have to code both the conditions. So whenever patient have a two conditions and both the conditions are in the exclude one of each other. In that cases, yeah, in those cases, we have to keep only one code. We have to use only one code. We are not allowed to use both the codes at the same time. So let's say our documentation states that patient has a partial loss of a teeth as well as a complete loss of a teeth. So for partial loss, we have a K08.4, and for complete loss, our code should be K08.1. Now we can see in our document, in our manual, K08.4 and 1 are listed in the exclude one of each other. So whenever a code listed in the exclude one of each other, that means we have to code only one condition at a time. We cannot code both the conditions together at the same time. So exclude one means that you have to use only one condition between this and the condition listed in the exclude one. Most of the time, we will prefer condition listed in the exclude one. However, ICD guidelines state that we have to keep most specified condition or most specific condition. So we have to use only one code, but in the manual, our guidelines state that we have to use most specific condition. Next, we have exclude 2. Exclude 2 note states, even though these two conditions seems to be same or alike, in that cases also we have to use these two code together. We have to code both the conditions together. So again, exclude 1 will tell us that you have to code only one condition, whereas exclude 2 will tell you that we have to code both the conditions together. Any question in exclude 1 or exclude 2?
Ma'am, can you explain excludes with example?
Yes, with an example. I haven't received any answers yet. Just send the answers over the WhatsApp. Okay. Let's do this question together. So our question states, patient with suicidal ideation followed by attempt. So we have to find out the code for both the conditions. Let's say suicide 360. SUI. Here we go. Suicide. So suicide attempted code should be T14.91. So for code to attempt, that is T14.91 exit. And now we have to look for a ideation. So to ideation, to find the code for the ideation, we have to look for ideation first, followed by the suicidia. Then we will look for the ideation. Let's try page number 250. Here we go. Ideation followed by suicidia. Code is R45.851. So now we have found two codes, R45.851 and then P14.91. Now remember, ICD coding is a two-step process. First, you have to look for the code, you have to locate the code, then you have to verify and apply the guideline. So we have to pull these codes in the tabular. So here we go to P14.91. Let's say, do we have any exclude here? So we just have the one exclude, which will tell P07. So we don't have that. So we have to make this code as in 7 characters. So our code should be T14.91XA. Now let's pull the another code. Our next code is R45.851. Here we go. So R45.851, we can see here in the exclude one of R45.85, we have the suicide attempt. So that means we cannot use suicide attempt and the code for suicide ideation together. Either we have to use C14 or either we have to use R45.851. So to determine which code we have to use the more specific code. So attempt is a more specific. So to answer this question, our code should be T45 14.91XA. We will not use any code for the suicidal ideation. Why? Because suicidal ideation and the suicide attempt are in the exclude one of each other. When two codes are in the exclude one of each other, we have to code only one condition. We cannot code both the conditions together at the same time until unless if there is any exceptions. So any questions in the exclude one?
No, ma'am.
Good. So just after the session, open your book and go through with the conventions one more time. And even after the session, if you have any question, you can ask over the WhatsApp chat. So next we have and. We have to use and, or the and word is used to represent the or as well as to represent the and. So in the short, we does not have or term in our manual. And is used to represent the and is used to represent the or. Now, question is how we will identify whether the and is used as an and or and is used as an or. So if the and is listed in the incomplete code, then it will represent the or. So again, if the and word is listed in the incomplete code, then it will represent the or. So if and listed in incomplete code, then it will be interpreted as an or. And if the and is listed in the complete code, like you can see here, this is the complete code. We have the and in the complete code. So whenever we have the and in the complete code, then it will represent and only. So again, when the and is listed in the incomplete code, it will represent the or. And when the and is listed in the complete code, it will represent the and only. So you can see here, this code is for tuberculosis of skin and subcutaneous. So with the help of this code, we can represent the tuberculosis of skin and subcutaneous both. But if the and is listed in the incomplete code, such as this one, this is an incomplete code and we have this and word here. So if we will build this code, we have a separate code for the bones and the joints. We have a separate code for the joints and the separate code for the bone. That means either we have to use a code for bone or either we have to use a code for the joint. We does not have a combination code to represent both the condition together at the same time. So whenever and is listed in the incomplete code, it will be interpreted as an or, and if the and is listed in the complete code, then it will represent the and only. I'm moving further. Let's read it once. So per book, it is saying the word and should be interpreted to mean either and or either or when it appears in the title. For example, the cases for the tuberculosis of bones and tuberculosis of joints is listed in the 18.0 subcategory, and we have a two separate code for the bone and the joint. So whenever and is listed in the incomplete code, it will represent the or only. And whenever and is listed in the complete code, it will represent and, complete and. Next we have with. With term is always listed below the default term in the alphabetic index. So we have to locate with term, or with term is always listed in the alphabetic index. So I'm pulling a random code here. So 1, 8, 8, 6, right? I think. You can see here. Here we have the diabetes. And under the diabetes, we have the main term, that is with. So this black bold term is known as default term. Black bold term is known as default term. And with term is always listed below the default term only. So with term, with is not listed alphabetically. With is always listed just below the default term. Why? Because whenever we have a combination code for two conditions, we have to prioritize our combination code and we have to use only the combination code. So whenever we have two codes, let's say we have a code, patient have a diabetes and amyotrophy. So we have to use E11.44. We have to use combination code to represent these two conditions. And we will always prioritize the combination code. That's the only reason we have the with listed at the bottom of the default code itself instead of the listed as an alphabetic index. So we have an instruction with the with that we have to use combination code until unless doctor will clearly state that these two conditions are not related to each other. Then only we have to use two different codes. If it is not mentioned, the relationship is not mentioned in the documentation or absent from the documentation, then we have to use the combination code. So just remember one thing, with is listed just below the default term because we always need to prioritize the combination code only. So let's read the with term. So it states that word with should be interpreted to mean associated with or due to. Then it appears in the code title. In the alphabetic index, either under the main term or subterm. And we can see the instruction note also in the tabular list. We have to presume a causal relationship. That means if the linkage is not documented in the documentation, in those cases, we have to presume the causal relationship between these two. And we have to code this as unrelated even in the absence of the documentation. Until unless documentation clearly states that these two conditions are unrelated to each other. Next we have C and C also. C and C also instructions are listed in the alphabetic index, which will
Excuse
C
me,
will
ma'am.
select.
I have a question from the previous question that you gave us. This suicidal ideation. So why did you take the code from ideation, not from the suicide, not from the S? You have taken it from the I. Why you have from I, not from the S?
We went to the suicide, and under the suicide, we look for the ideation. So let me pull the suicide first. So
It is mentioned in the suicide that in ideation, C ideation, but still they have
yes,
given a code like Z91.51. If they have written C ideation, then why they have given this code here
just a second. Huh? Gauri, can you tell me the page number, please?
for suicide?
Yes, yes.
372.
372. Thank you. So we went to the suicide, we went to the ideation, and it says C ideation followed by the suicide. Under the risk, this is another term. You can see here, these terms are listed alphabetically. Under the risk, we have the code Z91. This Z91 code is not under the ideation. Or are you picking here? So we have to make sure that we
So
will
this
read
Z91.51 include both suicide ideation and suicide risk.
not ideation, because this risk is not under the
Ah,
ideation. Let me zoom
okay.
this out. Just a second. Just a second. Huh? So our classification is also listed alphabetically. You can see here first we have suicide, and then all classification are listed in the first vertical line. Then we have the sub classification listed in the second vertical line. So ideation is a different classification, and the risk is in the different classification. This risk is not under the ideation. So
Okay,
this
okay, understand.
is a totally different one. Okay.
Mm, okay,
So
okay,
that's the
thank you,
only
ma'am.
reason to find out the code for the ideation. We went to the ideation instead of the suicide. Okay. So we just saw the example of C. C means we have to go at the some other classification, some other term to find out the code. Whereas C also will provide the example, will provide the code, but will tell us that if you need the further classifications or the further rationals or the reference word, you need to refer the another word. So we have already see the example for the C. Let me pull the another example for the C also. Let me see if we can find out. Da-da-da. C also. You can see here under the subluxation, symphysis, we do have the code here, but book is telling us that we can also refer the symphysis followed by the pubis. We can also refer this dislocation instead of the subluxation. So the difference between the C and C also, under the C, if we have a C word here, that means we have to refer the another term only. But for C also, if the classification is not completed, then only we have to refer the another word. Otherwise, we can use that code only. Okay. Next, we have code also. Like we have a two sequencing instructions, use additional and code first. We have another instruction that is code also. Code also will not provide the sequencing instruction. Code also will just tell us that we have to use one more code. We can use that code as in primary or as in secondary based on the region of encounter. But code also will just tell us that we have to use one more code. Maybe as in primary or maybe as in secondary. Code also is just listed in the tabular list only. So code also is not listed in the alphabetic index. It is listed in the tabular list only. So I'm going to pull an example if I can find any. Let's try 700.
जूली का कल का बन रहा है, शाम भी आ रहे हैं.
You can see here under the H47.6, our book states that code also underlying condition. It will tell us that we can code underlying condition also. That may be your primary diagnosis, that may be your secondary. That will not tell us that we have to keep that only as in primary or only as in secondary. We can keep it as in primary or as in secondary based on the reason of encounter. So we have code also instruction that will not provide you any sequencing instruction. But if you have use additional and code first, that will tell you the particular sequencing instruction that you need to follow. Next, we have default code. So the code listed next to the default term is known as default code. So I already told you default terms is term listed in the black bold letter. So I'm going to pull a particular example here. So this black bold term is known as default term, and the code listed next to the black bold term is known as default code. So default code means the code listed next to the black bold term, and default term means that unspecified term. So I'm going to mute myself. This is little bit important. Just read the default code line by line and let me know if you have any questions. Are you guys done with the reading?
यहाँ आ गए वहाँ.
Yes,
Next,
ma'am.
any questions?
No, ma'am.
Next, we have the code assignment and the clinical criteria. So we have to code the condition which is mentioned by the providers or given by the doctor. So we have to code only that condition which is given or described by the provider. We don't need to go through in the lab reports or read out the labs or go into the imaging reports and read out the radiology report completely. We have to code only the condition which is given by the doctor. We don't need to use our judgment also. Whatever given by the documentation, whatever the classification is given by the doctor, we have to code only that. We are allowed to ask for the class clarification if there is any. Let's say at the top of the documentation it says type 1 diabetes, but at the bottom it says type 2 diabetes. then we are allowed to ask the doctor, please suggest whether the patient have type 1 or type 2 diabetes. But we are not allowed to use a code for diabetes from the lab report directly. Now our conventions has been completed. Now let's start the chapter specific guideline. So we have total 22 chapters in our manual. So in our chapter, what we will learn? We will learn only the sequencing of the codes. That what will be your primary diagnosis and what will be your secondary diagnosis. So our all chapters are divided based on the type of conditions or type of condition as well as body system. So our codes are divided based on the type of condition as well as body system. So I'm going to pull the table of contents. So you can see here our chapter 1 defines certain infectious and parasitic disease codes are from A00 to B99. Chapter 2 will tell us the code for the neoplasm. Chapter 3 for blood organs, for mental and behavioral, 4 is endocrine and conditions. So these chapters are divided based on the type of conditions and the body system. So our first chapter is certain infectious and the parasitic disease. Code series A00 to B99. So codes listed from A00 to B99 will represent the infectious conditions or the parasitic diseases only. In this chapter, we have the sequencing instructions for the 3 conditions: HIV, sepsis, and COVID. So the first, we will start with the HIV, followed by the sepsis, and then COVID. So HIV stands for Human Immunodeficiency Virus. We have 3 stages of HIV. I'm going to pull that up. So code varies based on the stage of the HIV. Stage of HIV.
क्या आदमी है पापा को फोन करो
Stage.
खा ले यार
कच्ची भिंडी खा ले
हमने तेरे से मंगाई मिली वो खा लीजिए ना
मटन मटन बर्गर
So first, let's learn about the stage of HIVs. So the first stage is asymptomatic HIV. Asymptomatic HIV means that patient do have the HIV infection in her or his blood. However, virus or the infection and their CD4 ratios are equal, So hence patient is not getting any symptoms for that. So the code for symptomatic HIV is Z21. Whenever patient have the asymptomatic HIV, we have to use Z21 code. And Z21 code will always used as in secondary diagnosis. We cannot use Z21 as an primary diagnosis. Our reason of encounter in the cases of asymptomatic HIV, our reason of the admission or the reason of encounter will be our primary diagnosis. We have to use asymptomatic HIV as an secondary diagnosis. Next, we have the symptomatic HIV. This is the second stage when the patients start getting the symptom for the HIV or getting the HIV related illness. And the third stage is AIDS. First stage is AIDS. So for the symptomatic HIV and the AIDS, we have to use P20. So our code should be P20. And the sequencing for the B20 will be based on the reason of encounter. So P20 sequencing is based on the two situations. You have to see whether the patient is coming with the related condition. Related means HIV related condition or HIV unrelated condition. So we have to determine the sequencing. We have to see whether the patient is coming with the HIV related condition or HIV unrelated condition. So related condition means any other condition from series A00 to B99 or symptoms of HIV. Unrelated means let's say patient is coming with the fracture, injury, burn, any traumatic conditions. These are unrelated. These are just an example of unrelated conditions. So are sequencing based on the HIV related or unrelated. If the patient is coming with the HIV related condition, then we have to use P20 as a primary diagnosis and related condition as a secondary diagnosis. And let's say if the patient is coming with the unrelated condition, then you have to code unrelated condition as a primary and your HIV should be secondary. So whenever patient is coming with the HIV, then the sequencing is based on the whether the patient is coming for the HIV related condition or unrelated condition. If the patient is coming with the related condition, you have to keep P20 as a primary and that related condition as a secondary diagnosis. And how we will determine whether it is related or unrelated? Related condition means any other condition from series A00 to B99 or any symptoms of HIV or whenever patient is coming to get a treatment of from the infectious disease provider. Then we have to use A002, B20 as in primary. And whenever patient is coming as an with the unrelated condition, then you have to keep unrelated condition as an at the primary position and B20 at the secondary position. And remember, Z21 is used for the asymptomatic HIV, and we have to keep this diagnosis Z21 at the secondary position always. And the reason of encounter or the reason of admission will be our primary diagnosis for the cases of asymptomatic HIV.
ये उसका है ये
Now let's go through with the guidelines. So our first guideline states that we have to code only the confirmed cases. So code only confirmed cases means we are not allowed to use
तो साइज नहीं लेना
suspected condition, or we are not allowed to quote suspected, probable, possible, rule out conditions. We have to quote only when the condition is verified or confirmed by the doctor. Although we don't need to review the lab results or the imaging results, we have to verify the confirmation from the provider diagnostic statement only. But if the doctor says that patient had the probable HIV, you will not going to quote the probable HIV because it is not confirmed yet. So if it is confirmed, then only we have to quote. If it is not confirmed, we are not going to quote the HIV. I'm going to mute myself for the 5 minutes. You have to go through with the guideline number 1, guideline number 2, A, B, and C, followed by D. So you have to read asymptomatic HIV, patient with HIV disease admitted for unrelated condition.
बराबर देगी मेरी
So I'm going to mute myself. Just go through with the guideline first, second, A, B, C, and let me know whenever you are done. So we will scroll it down and we can go through with the guideline number D2. So I'm going to mute myself for the 2 minutes. Okay, I'm moving further. Asymptomatic human immune deficiency virus. So we have already gone through when the patient have the HIV, but it is not symptomatic. Then we have to use Z21 and we have to keep Z21 at the second position always. We cannot use Z21 as a primary diagnosis. Just go through with the guideline number D and let me know if you have any doubts. Also update me whenever you are done with this.
हल्का सा ढीला है टाइट है
And with the reading,
Yes, ma'am.
any questions so far?
No.
Let's move to the another guideline. Okay. So next guideline is patient with the inconclusive HIV serology. That means the HIV is not negative, nor positive. It is an inconclusive due to the specimen issue or due to the any issue. They are not able to find out any result from the HIV serology. So in those cases, what we have to use? We have to use R75. So whenever condition is not defined,
और जोड़ जोड़ के पूरा पर्दा बना दो नीचे
the result is not clear, neither positive nor negative in the serology test, we have to use R75 code in those cases. Next guideline we have previously diagnosed HIV related illness. So once if the patient is diagnosed with the HIV related illness, that means patient is getting a symptoms or the illness which is related to the HIV. In those cases, we have to use B20. So once you start using a B20 for a particular patient, you are not allowed to use Z21 or R75 in the future encounters for that same patient. So once B20 is established for a particular patient, you have to keep using B20 for that particular patient. You are not allowed to use Z21 and R75 for same patient in the future encounters. So just go through with this guideline and let me know if you have any doubts. Go through quickly. Done with reading. Any doubts, any questions?
मेरे से दवा क्या
Okay, I'm moving further, considering that you guys does not have any questions. So let's say next we have HIV infection in the pregnancy, childbirth, and the preparation. So whenever, okay, let's learn pregnancy coding here in a separate tab. Then we will move back to the HIV guideline. So whenever a lady is pregnant and you guys are coding for a pregnancy charge, you have to make sure that your primary codes belongs to the O series only or belongs to the chapter 15 code only. So your primary code should be O series. Your secondary code should be your disease code, and your tertiary code will be weeks of gestation. So let's take an example. Let's say a lady is pregnant and now suffering with the HIV during pregnancy. So what you have to do? First, you refer the pregnancy in the index first. And under the pregnancy, you will look for the diagnosis or the condition the patient have. So let's say patient have the HIV. So under the diagnosis pregnancy, you will look for the HIV. You can see here we have the code O98.71. So your primary code should be O98.71. Then your secondary code should be for disease. Let's say patient have the symptomatic HIV. So your second code should be P20, followed by week of gestation. To find out the code for the week of gestation, you have to refer the pregnancy. And under the pregnancy, you have to refer weeks of gestation. Let's say patient is 29 week pregnant. So your third code should be Z38.29. So whenever you are going to code a charge for a pregnant lady, you have to make sure that your primary code should be from series O, followed by the B20 condition specific condition code, and at the end you have to code weeks of gestation. Weeks, to find the code for the weeks of gestation, you have to refer the pregnancy itself. Under the pregnancy, you will look for the weeks of gestation. And you can see here, our pregnancy codes are incomplete. You can see these codes are incomplete. To complete these codes, we have to refer the alphabetic tabular, not index, my bad. So we have to refer the tabular. Here we can see we have the O98.7. So we have to pull the same code in the tabular. We found O98.71 in the index. And now we can see we need 6 characters to make this as an assignable code. And now this code divided into the 4 part based on the trimester. So we have to use first trimester when the lady is 0 to 13.6 week pregnant. So if the lady is 0 to 13.6 week pregnant, we have to use first trimester. 14 to 27.6 second, 28 to delivery, third trimester. So you have to use first trimester if the patient is 0 to 13.6 week pregnant. If the patient is 14 to 27.6 week pregnant, you have to use second week or the second trimester. And if the week of gestation is 28 to delivery, you have to use third trimester. So like we are doing one question, we use 29 as a week of gestation. So our answer should be 98.713 as in third trimester, because 29 week of gestation will come under the third trimester. So whenever you are going to code a condition for the pregnant lady, you have to refer the pregnancy first, followed by that condition, and in the last you have to code the weeks of gestation. Our pregnancy codes are divided into 3 parts based on the trimester, and the trimester are based on the weeks of gestation. I'm going to send one question related to this. We will do that question first, then we will move further. In the meantime, did you have any questions which you want to ask before the question? Does anyone of you have any questions?
No, ma'am.
Okay. Now let's attempt these question or this question together. So I'm going to drop that question over the. So our question is, Patient is 32B, pregnant, and coming with the asymptomatic HIV. Asymptomatic HIV. So what we have to do, whenever a girl is pregnant, we have to find a code from the pregnancy section. So we have to refer the pregnancy first. Under the pregnancy, we have to look for the condition. Patient is coming with the HIV. So our code should be 098.71. 098.71. This is an incomplete code we have to complete, so we will complete it later. Next, we have to look for the asymptomatic HIV, which we have already read, that for the asymptomatic HIV code should be Z21. And then we have to look for the 36 weeks of gestation. So for the weeks of gestation, what we will do, we will refer the pregnancy itself, and under the pregnancy, we will look for the week of gestation. So for week of gestation here, it was 32. So we have to use Z38.32 as a third code. Now, let's complete this 098.71. So we have to refer this code in the tabular. So 098.71 is divided into three parts, not three, four, based on the trimester, and the trimester is based on the weeks. So if the 0 to 13.6 week comes under the first trimester, 14 to 27.6 comes under the second, and 28 to delivery comes under the third trimester. So our patient is third at 32 weeks, so we will use third trimester. So our answer should be 098.71. Okay, now it is 6 character code 1, 2, 3, 4, 5, 6, and this is an complete code. This does not need the further clarification or the further additions. So our answer should be this. Any questions, any doubt that how we reach to the code? Any questions about the sequencing? Yeah. Okay. Now let's go back to the guideline. Our next guideline is HIV infection in pregnancy, childbirth, and so again, we have to use 098 as a primary, followed by the P20 or Z21. Then our third code should be suggestion. Now let's move to the next topic. Counter for testing of HIV. Whenever a patient is coming for the HIV testing or even for any screening, I'm going to discuss screening in the separate tab because this project we have to follow in the old manual. So whenever a patient is coming for the testing or for the screening, we have to follow the two. First, we have to look that the patient is coming with symptoms or without symptoms. So let's say the patient is coming with the symptoms, we have to code symptoms. We will not code the screen. We have to code symptoms. No need to code screen. We are not going to code the screening, you have to code the symptoms. And if the patient is coming without symptoms, then only you have to code the screening code because patient does not have the symptoms and coming solely for the screening purposes, So you are going to quote the screening. And in conjunction with the screening, if the patient had any exposure to infection, you can use exposure as in secondary diagnosis. Your exposure will be secondary diagnosis. So whenever patient is coming to get a screening of any condition such as HIV, COVID, sepsis, any virus diseases, you have to review the chart, need to verify if the patient is coming with the symptoms or without symptoms. If the patient is coming with the symptoms, then it will be considered as a disease management and you have symptoms as a primary diagnosis and exposure as in secondary diagnosis. And in the same and the patient is coming without symptoms, then only you have to put screening as a primary diagnosis. To find out the screening code, you have to refer screening in the index. Our screening codes are listed from Z series. Yes, you can see it. These all are the screening code. Let's say patient is coming for the screening of HIV disease, testing for HIV. So our code should be Z11.4. But we will use Z11.4 only if the patient is without symptoms. If the patient is having a symptom, you will code symptoms. You are not going to code the Z11.4. And with the symptoms, if the patient is with symptoms or the without symptoms, in both cases, if the patient had the exposure, then you have to code at the exposure at the last or at the secondary position. It will represent the high risk behavior or high chances that patient will get the infection. So this is the same guideline which we just discussed. If after the encounter or if after the testing patient result came as a negative, then in that case you have to use that 71.7. If the result came as a positive, then you have to use B20 or Z21 based on the symptomatic or asymptomatic. And if the result is inconclusive, you have to use R75 to represent the inconclusive. Next, we have HIV managed by the antiretroviral medication. If the patient's current HIV is managed by the long-term use of antiretroviral medication, in that case, you will use Z79899 as a secondary diagnosis to represent that patient is using a medicine from a long term. And if the patient is coming for the HIV medicine before the exposure or before the diagnosis of the HIV, so let's say patient is coming for the HIV vaccine or the medicine, even though patient does not have any exposure as of now or any infection as of now, but patient thought that she or he might get the infection in the later in the future. So even whenever patient is getting for the medication, prophylaxis medication for HIV, pre-exposure, before the exposure of HIV or before the infection, in that case you have to use Z29.81 that to represent that patient does not have the HIV as of now, but patient might get HIV in the future. So I'm going to mute myself for 2 minutes. Take your time, go through with the guideline number H, I, and J, and let me know if you have any doubt. So it's 5:03. I'm going to mute myself for just go through with these guidelines. Let me know if you have any